everybody to Empowered Podcast. I'm Christina.
And this is 𝓲𝓸𝓷𝓼𝓽𝓪.
And this is an episode that I'm really looking forward to. We're going to dive in on non-invasive treatments for anti-aging, cosmetic, and even body contouring.
Mm-hmm.
So if you're somebody who's contemplating undergoing cosmetic surgery, you're not happy with either the way your skin or your physically, your body, well, I want you to know what is currently available. I mean, technology and science has evolved so much that there is, almost every issue that we face, when it comes to anti-aging, and it can be combated. It can be addressed with non-invasive technology.
Yes, and this is a subject where you are the expert in a lot of non-invasive procedures, especially because of the aesthetics part of it. And I have a few that I practice at 𝓲𝓸𝓷𝓼𝓽𝓪, so we'll talk about those that I use more for the body contouring.
Okay, well, let's first start off by addressing issues that one might experience that they're not content with. So the biggest issue in my profession when people are not happy and they come to me. Now, mind you, in my profession, I dress whole person. And that's important because often what we see happening on the outside is a reflection of what's really happening on the inside. So just addressing what's on the outside isn't always going to fix the problem. It's like putting a Band-Aid on a wound. It's going to help heal, but then again, it's something that's temporary. You have to clean it, you have to address what's going on. So one of the issues is wrinkles, fine lines and wrinkles. Okay. Another issue would be loss of muscle tone and loss of the elasticity, which is ultimately a result of what? Lack of collagen. What are some of the issues? Go ahead.
Well, in body contouring, you have the loss of the skin, like the elasticity. Like people gain a lot of weight and lose the weight, and over the years that losing weight, gaining weight, even if it's just like a pregnancy one, but just one time, it's not like going back and forth, it's still like a lack of elasticity. Another one is the cellulite, like the appearance of cellulite.
Yeah. Also something as we age, people often come in, and let's just reference the lower body, and they often identify a cellulite when it's actually just loss of elasticity, in the chicken skin. And so they're thinking like this is cellulite, and it's not. It's just the skin that's rippling because all elasticity has been, lost through
and the muscle,
and the muscle tissue.
Loss of tone.
Right, and muscle is what holds skin up. Fat and muscle hold skin up. So that happens a lot, and that can also be addressed. We have problematic issues, which are a big concern for many younger, individuals, but even hormonal acne. Do you know any women our age that experience hormonal acne?
Older.
It's devastating. Like, what the heck is happening?
Yeah.
So, and there's even secondary non-invasive, which is, botulinum, toxin, Botox. There's also fillers. There's what we call 𝓘𝓷𝓼𝓽𝓪. So we're going to just kind of go in depth a little bit on some of these not alternatives, we should say alternatives to cosmetic and plastic surgery. Anything you want to touch on? You have a good week?
I have a good week, yeah. I'm thinking like, okay, you're like the expert here. What do you want me to say? I would put myself today in this episode, I would put myself as like someone learning. Because I'm very familiar with the body contouring one, but as someone who has been losing a lot of weight because of the semaglutide, we talk about that in another episode. I have been very thoughtful about taking enough collagen because of my skin, especially in my face. And last year I did a filler, like something on my, like under my eyes for dark eyes. So I used that. I also used some of the Botox one time, but it gave me like a swollen and a reaction that I didn't like it. So I'm gonna deal with the wrinkles because I don't want to do the Botox. And I know you like the Botox, and some people that I know also frequently use and they love it. So
yeah. Well, let's just start with that. So botulinum toxin A is what Botox being brand name is so effective in also as being proactive against, the deeper lines, expression lines. We call them expression lines because they're a result of the muscle movement. So when I see young girls like in their like early 30s and they already have deep lines, and I can see when they're talking, they're a good candidate actually if they want to be, kind of proactive and prevent those, because it's often once those lines are set in the forehead, there's not much you can do about them, right? Even like if I separate and I can still see them, then that's
actually there is something you can do with the massage.
Well, no, not when you have lack of collagen. Now that's where it's actually formed a concave line. Massage isn't going to remove that concave line because it's part of their physiology now of the skin.
Okay.
Yes, massage will help with toning muscle movement, relaxing muscle movement. So, but Botox, people think of Botox as here, like here or around here. But do you know Botox now is used in so many other places? For the lower face, lifting of the lower face, for the neck, the platysmal bands here, just tightening of the neck. When you put these muscles to sleep in the lower, it helps lift this up, right? So, and then just in this area here, hitting certain muscle groups in here. Now, I'm not an injector. This isn't my profession, but I do work with many NPs and nurses that do my patients that use Botox as an anti-aging remedy, and I'm actually amazed with what it can do. So, okay, yes, it's a toxin. We did an episode on how to alleviate or combat toxins, but you got to choose your
villains.
Yeah, you got to choose your villains. And there's so much case studies that show the amount, and the fact about Botox is temporary too, So what you're exposing to yourself as that toxin versus the other toxins in the house cleaning agents that you use, So it's something that you got to just choose what's best for you, but it's highly effective, and I give it 5 stars for anti-aging.
And there's something also which is the medical, when people have headaches. I see a lot of people using the Botox for muscle tightness because it constrains the muscle, it creates firmness in the muscle. So some headaches are caused by lack of muscle tone, so it helps with the muscle.
Oh yeah, there's new case studies where they're researching the impact of toxin put in this muscle right here, because this muscle leads to depression, and by kind of putting that muscle to sleep, essentially, it helps alleviate signs of depression. So there's more case studies being done on that. Interesting. All right, so let's name them off. So we've got fine lines and wrinkles, right? We've got lacks of collagen or skin kind of falling. Same with on the arms, the lower legs. We've got increased fat levels, right? So body contouring. We also have congestion under the skin. That just means the texture of the skin and the skin barrier has been compromised. So it's not smooth anymore. That's another big one. What do I do for smooth skin? What do I do for brightness? My skin has now become dull.
Like a glow. What do you want to,
how you do
glow?
that glow? Yeah.
So
we're going to go into that. So my first on my list, so we got Botox out of the way. That was going to come later, but it came up in conversation. So 5 stars for Botox. Okay, I'm a supporter of it. Do I use a whole lot of it? No, I don't. I've never had wrinkles in my forehead. Never. But if you do one area, you got to do another. But I think it's great for brow lift. I like it for around the eyes. So yeah, I'm a supporter of Botox. Okay, so another one of my favorite, non-invasive, and it's relatively here in the States, kind of really gained momentum in the last 10 years, is fractional microneedling. Fractional RF microneedling. So it's combining microneedling, which is uses collagen induction, and it enables us to create microscopic channels in the skin to deliver amazing pharmaceutical grade ingredients to help accelerate collagen production. The fractional RF is radio frequency. It's an ultrasound technology that not only stimulates collagen, helps to increase like muscle tissue, but it also has the ability to dissolve fatty cells. So it's like best of both worlds coming together in one technology, one device. Numbing is required for this. So if you're an individual who is losing muscle tone, right, the skin is falling, the texture, hyperpigmentation, deep lines, fine lines, you might consider fractional microneedling. It is done with a device that simply infuses the RF through the needles, the 24 karat gold needles. It infuses it into the skin, and then again we are infusing a product into the skin that addresses your specific issue. So
okay, so my question would be
and it can be used anywhere on the body too.
Okay, but how do you do a treatment? Do you do like a large part? You do a short, like how do you do treatment? How often you do like?
Okay, great question. So when it comes, this kind of rule of thumb crosses over in both the health and the aesthetic industry. 3 and 3. 3 months to see results, 3 treatments at minimum. That is a safe rule of thumb, and the reason why is because we have this cell rejuvenation cycle, and that's dependent on your age. So for instance, our age category, without telling our age, we're at about 45 days. It takes for our cell to completely rejuvenate, okay, new cells to be formed. And so that, you're not gonna see results at least for that to happen, right? But you also have the period of when the skin cells are dying off and then new skin cells are forming and coming to the surface. And you have the waiting period or the incubation period where your body is alleviating toxins or alleviating fat, whatever the case may be, and then responding to the procedure. And that takes anywhere from 8 weeks up to 12 weeks. So 3 months is a good 3 months. I can say you will see the results of any of the procedures we're going to talk about.
So you
today.
have to be patient.
Yeah, and 3 treatments at minimum. Doesn't mean to say that you're not going to see results from one treatment of some of these modalities we're going to talk about, but it's usually 3 sessions. Then you can really start to gauge
how far apart.
Okay, so it depends on the treatment and it depends on the individual. If you want to be aggressive with something, like let's say for instance somebody came in and they wanted to undergo microneedling for problematic issues, acne. Well, you have to wait till it's non-active, but then you want to be aggressive because you're going after pitted skin, right? So you don't want to give the cells a chance to reform. You want to still go after the tissue layer that's still being impacted. So you might come in every 2 weeks. Maintenance is always 1 month. It's a good maintenance period. So if somebody were coming in for fractional microneedling, since that's what we're talking about, it would come in once a month for maybe 3 sessions. And then you're going to go into a maintenance period where you're going to come in every 3 months. So to achieve those results, 3 months, give 4 weeks for healing, and just a little bit of downtime. You always want to allow the body to do its natural healing process. So that's kind of a rule of thumb again.
And then, so let's say, how long do you stay with an area? Like, do you need to do 20 minutes in the area? You need to do 10 minutes in the area? Like, you do like an hour in the whole body? How?
So when we're talking about fractional microneedling, you're going to limit the body because it requires numbing. Number one, numbing has a lifetime, a span of, about anywhere from half an hour, depending on the compounded formula that you're using, half an hour up to maybe an hour of time frame that you have before the body starts like tapping out or if they're no longer numb. So that's going to limit you to how much of the body that you can work on. So typically A fractional microneedling session would probably last, with, of course you're numb by this time, with maybe 20 to 30 minutes. You don't want to go over that because also the body's responding. It's going to feel this little bit of pain associated with, some people are going to say a lot of pain, but a little bit of pain. So you don't want to expose the patient to too much, of that. You want to break it up into sessions. So if you're doing a body area, let's say the back of the thighs or the stomach, if a woman has stretch marks, or you're going to just work on this area. And yes, can you jump around from different areas with any of the treatments that we're going to talk about? Yes, you can, but I like to focus on one area before jumping around so that they can gauge the results, right? They can watch it and see what's happening.
That's great, yeah.
Okay, so 5 stars, fractional microneedling, okay? Then let's take that from just microneedling. Again, we said microneedling it's a collagen induction because it's causing injury to the skin. And then, in your practice, the body responds to injury. It goes into a healing mode. So when it does that, it increases oxygen to the cells, it increases blood flow, and that in turn ignites fibroblasts, and fibroblasts is what creates collagen. So you have this whole healing response when you're causing these microscopic injuries to the skin, but you now just created these channels in the skin. Case studies show that these channels stay open anywhere from 6 hours up to 24 hours. Some case studies even showed 48 hours, so 6 to 24 hours. That you can be infusing amazing products at a lower level into the skin. Pharmaceutical grade, meaning not cosmetic grade, so they're highly effective. That can come in the forms of EGFs, which are epidermal growth factors, or stem cells, plant-based. Some people use, from human stem cells. I don't engage in any of that, but so good for you, hyaluronic acid, so it's going in at a deeper level. Therefore, it's higher, it's more effective, and you get better results.
I actually got that one.
Microneedling.
No, the 𝓘𝓷𝓼𝓽𝓪 acid.
Hyaluronic acid.
Yeah, I did that, and I did that on my knees as well.
So you had it injected into the knees. Yes, absolutely.
And a question I have for you is, who are certified or licensed to do those procedures?
So I am an educator, and I teach students all over the world. And something that I tell them is that they have to check with their own governing boards within their state or within their country. And that means that you need to find out if it's within your scope of practice. So for me, it's not to say you have to just check with your governing boards, your state or your country to see if that's within your scope.
Is it common?
What?
Sorry, I interrupt you. Go ahead, finish it.
Is what common though?
Is it common, like, estheticians be able to do that, or it's more like a dermatologist or a nurse?
It depends. Again, it's not the question wouldn't be is it common. The question is you have to know what your regulations are and what your governing boards. There are some countries like India. I have students in India. They're not governed by any board, medical board. So you've got people who never went to medical school that can perform certain procedures. There's also, within microneedling, there's called nanoneedling, which never penetrates beyond the epidermal layer of tissue. So in the state of California, licensed estheticians without any other board certification or licensing are allowed to perform nanoneedling, which is highly effective. It can infuse products into the epidermal layer of tissue and stimulate natural collagen production.
So it's the first level, and then if you want to go deeper, you go with like a...
Yeah, so again, people have to understand that what their depth of penetration, what their scope of practice allows them to do. California, it's 0.25. And it's different from, even some states have different counties regulations. So it's really important to do your homework and discover what's within your scope of practice. Moving on, when it comes to, so when somebody says, I have all these issues on my skin, fine lines, hyperpigmentation, melasma, the skin texture, my go-to for resurfacing would be chemical peels. I love chemical peels because you can actually create a chemical peel specifically to the person's issues. And there's chemical peels come in 3 levels, level 1, 2, and 3. Level 1 is superficial, 0 downtime, and they address everything we just talked about. And it's all about resurfacing. So they can literally go back to work, takes about half an hour, no numbing required. It can be specified, compounded specifically to address the issues that you want. Then level 2 is a little bit more aggressive, you know, it's gonna, oh, and let me go back to level 1. There's some chemical peels, for instance, glycolic acid, that won't, it doesn't give any visual peeling, meaning it's peeling, it's sloughing off, but it happens while you wash your face or while you're sleeping. But it's not like you're gonna walk around like you're peeling from a bad sunburn. But level 2 are a little more aggressive. You will definitely experience, with the exception of glycolic, visible peeling at a higher level, kind of like a snake or a really bad sunburn. Level 3 is a whole different ball game. I do not perform level 3 myself. I don't perform level 3 chemical peels. That's out of my scope, and that requires like at least 1 week to 2 weeks downtime. You look like you are a burn victim. You could be prone to infection, so it's, you know, many physicians will put them on antibiotics, and there's a lot of restrictions, you know. But like with all chemical peels, exposure to the sun, and any of the treatments that we just talk about that are resurfacing, like microneedling, any exposure to the sun is it's highly sensitive, and so you got to really protect yourself from the sun. So I wouldn't recommend these treatments in the mid-summer if you are a person who enjoys the outdoors. Okay,
you protect your skin.
Yeah. All right, so that's talking about resurfacing. Another resurfacing is dermabrasion, microdermabrasion. Today's method that's used is crushed diamond tips. Actual diamonds are crushed and make a bit that fits on the end of a device, and it sloughs away, exfoliates the dead skin cells. And a lot of people don't realize, like, I know women get older and are saying, I don't have oily skin, but yet my pores have enlarged. That's because debris is now sitting inside those pores, which makes them expand, and that debris is often dead cells that they haven't exfoliated. Now, exfoliation at home should be done once a week, but sometimes you have to step up your game and you have to go in and have it professionally. Layers of dead cells sitting inside the pores, causing not only the inability of penetration of products that are being wasted on dead cells, but oxygen going in. It's enabled to, because of the dead skin cells.
It creates a barrier.
A barrier. So it's really important. And you know you have an accumulation of a lot of dead skin cells when you look in the mirror and you're like, God, I kind of look drab. I see no peakish hue. And that's because you have all this dead skin that is covering the new cells. So dermabrasion, highly effective. I love it. Okay, another one. We're gonna go, before you want to wait, we'll save body contouring towards
the end,
for
so
the end.
that I know a little bit.
Yeah. I'm gonna talk about one thing that we're really gonna touch on is the infrared, near infrared, and red light therapy. We're gonna go into depth in that one because it is one of my favorite sciences.
Yeah, and it has been so like used now, and whoever uses it is. And I don't know much about it, so
yeah, well, and it's okay because we have resource right here in front of us, but it is my go-to because it does everything for the whole internal body: physical, mental, anti-aging, healing to cells, DNA. It's just
it basically reduces inflammation, right?
Well, it does a lot more than that. It's not just about reducing inflammation. I mean, it repairs damaged cells. There's case studies that support that it heals cancerous cells, that it rids the body of cancerous cells. And it's just ongoing, created by NASA, and I use it daily. Like I'm saying in my practice, to address chronic pain, to address anti-aging, to address weight loss, to address hair loss. I mean, the list just goes on and on. And you're going to find more and more practices incorporating infrared and red light into their practices. And of course, it doesn't stop at just red and infrared. It's blue light. There's every color has, multitude of benefits. But specific to this episode, we're going to touch on that.
Correct.
The other thing I want to talk about, people ask about PDO threads. Do you even know what PDO threads are? So they make these PDO threads now that actually, now we're talking non-invasive in the sense of you don't have to go under, right? You will be numbed, but they place these threads inside the face, and they have, when it comes to cogs, there's like these little hooks around the whole thread, and we're talking, it's like
very
micro. Very micro. But these little anchors are inserted, and then they tug on them, and it anchors into the flesh, the tissue, and then they just tie them off. And so they are able to lift the skin or tighten the neck. So these are cogs for lifting and tightening. And then the other type they have of PDO threads are monos or twist. Those don't have the actual hooks on them. The twists are actually textured, so they create microscopic injury in the skin. The skin responds, and what happens when the skin responds? It ignites these fibroblasts, which creates collagen. So they put these like monos or twists into the skin just to induce more collagen, to make, and those are highly effective. As far as the price point, I would say far more affordable than undergoing any type of facelift or, and it's somebody who's like just about there, but they're financially not ready to commit, or they don't have downtime, or they're so frightened to undergo facelifts or neck lifts or anything. So that's another alternative you're going to want to research and see if you're a good candidate for that. There's one woman I follow on social media, Francine, queen of threads. She does amazing work. A nurse I work with also performs these. Great results. I have some before and afters on my website of some of her work that she's done. Wow. And it looks very natural, and they self-dissolve. So it's not something that needs to be removed. They're self-dissolving. So anyways, let's go into body contouring.
Well, before we do the body contouring, tell me about the red light.
That's going to be so in depth. That's why I'm going to save that one
for last.
Yeah, because we're even going to.
I'm curious about that one. Well, the body contouring is what we use for the fat, break down the fat, is the cavitation, and there's also the machine, the procedures that do cryolipolysis. Did I say it right?
Yeah.
It's the destruction of the fat cells, which is a non-invasive alternative for liposuction. And the way it works basically uses low temperature, very cold. And you remember like minus 10 Celsius?
So let's break it down for them. So when it comes to body contouring, let's first understand the different technologies and science that are currently available to address body issues, be it accumulation of fat, be it muscle loss, or be it just skin tightening and toning. So the technologies are ultrasound, which you're talking about cavitation, our radio frequency also falls in cavitation. Then we also have heat, which also a form of radio frequency provides heat, okay? And then we have freezing cryolipolysis, which would be freezing of the cells. So there's different sciences and technologies available, and the practitioner or the technician would have to be able to identify what technology they want to incorporate to address what particular issues. So cryolipolysis, yes, freezing of the fat cells, at least at a minimum of negative 10 Celsius. Some devices, without naming brands, can negative 30 and to fully destroy the actual fat cell.
Here's something that I learned for myself that I make it simple. The difference between cavitation and the cryolipolysis. lipolysis, is that one destroy the fat cell. So it eliminates the fat, like break it down and eliminates the fat cell. So the body has to release the fats like as a waste. The cavitation, which is like lipo laser, other forms of ultrasound.
Lipo-laser is not considered ultrasound technology. Lipo-laser utilizes light therapy.
Light.
And heat.
Okay. But what I understand is that those procedures with the cavitation too, with the ultrasound, they empty the cell. Like they empty the fat, that like the toxins and the fluid that is inside, the content of the cell. So the cell never die.
So cavitation actually does destroy the cell. It disrupts, the ultrasound sends such a high pounding frequency on the cell that it disrupts the membrane of the cell, forever destroying it with the contents, the liquefied fat inside, being released into the system. Lipo-laser does not destroy fat cell, it shrinks the fat cell. It's that the pressure, the heat is kind of, the membrane is never disrupted. It's disrupted, but it's not destroyed, but it does shrink it. So it's a good candidate for people who are, I like to say, who are up and down in weight, or their weight is always fluctuating because they're not in control of their diet. And if you go and destroy fat cells in a certain area and they gain weight back, guess what? That fat's gonna go somewhere on their body. It's just not gonna go back to where there's no longer fat cells.
So then you have the wave.
Yeah, or you have.
It doesn't look nice.
It's not smooth.
It's not smooth, yeah. Yeah, so then the cavitation machines are very good to help with, I would say, any type of body contouring. And what I like about I use the cavitation with the body contouring, and answering the questions I had for the other machine. I usually recommend people to do 2-3 times a week at the same area, about 10 to 20 minutes in an area. So we stay in the area because it takes time to make that process. And then in our case, we finish with the massage. But so you do often, and then you have to combine with other forms, because if you are eliminating the toxins and the fat, and then you're ingesting things that are counter to that process. So then exercising and nutrition is very important for you to see better results in there.
So cavitation, let's focus on cavitation for a moment. So we've concurred that cavitation does, science shows, case study shows that it does destroy fat cells. Cavitation can be used in different, and it's kilohertz, that's how it's measured, okay? So anywhere from 25, 30, 40, all the way up to 80, okay? So the lower the kilohertz, KHZ, is used more for dense fat, thicker fat, deeper fat. It has the ability to penetrate deeper and go after that. When you get to the higher, such as anywhere like 80, sometimes even 40, it's going to target small molecule fat. The fat we reference is cellulite because it lays against the superficial layers of the tissue, okay? So, and yes, downtime in between, at least 3 days to 7, because of what the liver has to go through and process everything out. So you need downtime, and you are flushing with water.
That's why the massage really helps to increase the detoxification after that, because the fat cells contain toxins and fluid. So when you're releasing that into the body, it's a lot of toxins that has to come out.
Yeah, absolutely. So one of the things too, so cavitation. Then you have also radio frequency, kind of in line with cavitation as far as like minimizing fat. But you also, with radio frequency, you also get the benefit of toning muscle and toning skin tissue.
Because it increases the production of collagen. So it helps that, so it kind of goes together.
Right.
And sometimes sometimes people come like asking me my advice about doing cavitation for with a lot of loose skin. And then sometimes like you need to go, sometimes you do have to go to the doctor and have like a tummy tuck or a small surgery, a plastic surgery, some kind of plastic skin removal, because it has been so long or has been lost so much elasticity that losing the fat would not like the skin will not retract. So
yeah, and that's the thing too. I think so. I created this course that I created for this company that I used to work for, and I called it 4D Lipo because I believe that it incorporated some of the best technology that's currently available, and it's not a one size fits all. I use that motto a lot, but I really mean it. Is you got to really know the person. So it incorporates. We talked about cavitation. We talked about radio frequency, and then you mentioned lipolaser. Lipolaser shrinking of fat cells, but not destroying it. Because there's some areas where you want to just shrink, and you have to know the patient. If this is a patient that is like it's targeted areas to where that's where they tend to carry their weight, and they have yo-yoed, or they say to you that I go up and down the scale a lot, and you know that their chances are they're going to gain weight again. So you want to shrink that fat cell, but if you end up destroying it, then the fat's going to go somewhere else. So kind of combining the different technologies, I think, is a more strategic and safer approach. Just like cryoliposis. Now, you had a bad experience, or someone that had a very bad experience, but I'm going to say this, it's pretty effective, but for spot reduction, like not large areas.
Yes,
it needs to be targeted. Some people have a little love handle, or they have a little fat pocket under the booty, and I think it's effective that way, but it's not for overall body contouring. I personally
I look for research about that, and some of the cryolipolysis, at one point we thought about bringing the machine at the office, and I sent everyone for training, and one of my staff members got like a reaction, and then the study was saying like some kind of complications. Now it's not a common complication, but it can happen, right? And it's called erythema, bruising, swelling, sensitivity, and pain. After a week or two, I think after a week and a half, she was fine, but it was painful for her. But she was already someone who was already dealing with a lot of inflammation in her body, and I think that contributed to that side effect. So I would like do the research, make sure your body is in a healthy position, like you said, is like localized areas, not like the whole body. Then another complication is it's called, the technical term, adipose hyperplasia, which is like the growth of the fat. I actually know a mother and a daughter that had a reaction, and she was very skinny, she was very healthy, and unfortunately it was a reaction that both of them had. And then the company paid for the liposuction, so she ended up having to do the liposuction after to remove. So just make sure you do the research. There's a lot of people that come that was successful, but again, majority of them that I see is because they had a small amount of fat, their BMI is normal, they just wanted that little pocket of fat that the exercise and the nutrition didn't help.
There's going to be side effects to many procedures, and always the health, you want to be in optimal health going into something like that if you're looking to achieve the best results, and not always just relying on any treatment. You got to follow up with post-care, and doing what you can at home to strengthen the results and maintain, and look at things as not a one and done. Looking at things as therapies. I mean, you go to the gym, it's therapy, you need it. Just like your lymphatic drainage. I mean, it's not a one and done. It is constant therapy, constant maintenance, and the older we get, the more maintenance that's required. So it's important for therapists and practitioners to educate their clients and patients.
Let me add on, a lot of people have this, I don't know a lot of people, but I've seen people who have this illusion that you're gonna go get a liposuction and then you'll be fine. Unfortunately, if you don't do the healthy things to like keep yourself into the detox mode, keep yourself into maintenance, you can just like get it back, you know, or you have like and it might even create like some fibrosis. It may create like the undulation of it. You know, there is like there is an invasive treatment when you have liposuction. So so it's very good to do like the non-invasive. If you need to do the invasive, do the invasive, but take care of like the post-care is very important.
Yeah, and make sure that you research your practitioner and, you know, look to see their before and afters and, you know, reviews. That's always important. So we're about to go into my favorite science.
She's saved for the last.
Technology, yes, because it's very broad and it's not, you know, and that is infrared and red light therapy. And I know if you're watching this podcast, that means that you've probably already heard about this and how you can incorporate this into your life. And this is something, because again, referencing therapies, yes, I offer it at my practice. Soon you'll be offering it at your practice. But it is so healthy for you, your whole state of mind, that it's something that should be practiced on a daily basis, or at least 3-4 times a week at minimum. So it's good to invest in a device that you can even use at home. And we don't have time in this episode to fully educate you, but you will, if you come back and subscribe to our channel, you're gonna hear us talking about it a lot in the future, because it just kind of, like I said, it just is so overall healthy for you that it's tied into episodes that we're going to talk about mental health or empowering women to, you know, with anti-aging, or just amazing hair loss. Okay, so red light therapy, I'm going to refer to my notes a lot because there is a lot to consume. And if you guys have, if you want to take notes or just, you know, save this podcast to your channel, do so, or this episode, I'm sorry guys, do so, because you're going to reference back to this a lot. So first of all, let's talk about the wavelength. So when we talk about LED light, it's measured in wavelengths, and every color has the ability to penetrate a certain wavelength. And within each tissue of our body, each tissue is where certain things are composed of. We talked about the epidermal tissue, right, earlier. Mostly composed of dead skin cells, 𝓲𝓸𝓸𝓷𝓼𝓽𝓪, but it's the barrier, it's the protector of all other layers. Then we have that dermis layer, which is where collagen is produced, and, you know, we have our pigmentation that's produced in that area, and we have where fibroblasts are ignited. So that's like the living tissue that kind of is what we all visibly see. Then you have the hypodermis. Then you get down to the subcutaneous layer of tissue, and that's where you find your muscle tissue and your fatty and everything else. And so red light, when it comes to red light, the ability to penetrate all layers of tissue. And that's why it's so highly effective and addresses so much, because it can address all the different issues that are found in all the different layers. The wavelength of red light falls between 620 to 700 nanometers. Okay, so how does a person know if they're looking at a device? Is it effective? Is it just colored red light, LED? Well, you have to really do your research, and guess what? I did the homework for you. You can go to 𝓘𝓷𝓼𝓽𝓪 to our storefront, and there are some of the devices that I recommend. I researched them, looked on the FDA website, see if they were registered, see, you know, read the reviews for you. So anything from a handheld device to a mask to panels, which can be used for, to address pain or fat loss, to full panels, front and back for, full body exposure. So it's right there at 𝓘𝓷𝓼𝓽𝓪. So make sure you guys check that out after this episode.
I have a question. Can I ask now or later?
No, if it's, go ahead.
So I'm getting curious about, like, okay, so let's say I have my knee. I have been dealing with my knee. So how often do I, like, let's say I buy something for a local thing, right? How often do I use? For how long do I use?
Okay, so the recommended exposure time, we will be getting to that. We're talking about just overall benefit from it. When it comes to isolated issues, for instance, in chronic pain, it's something that you're going to want to just keep addressing every day for 10 to 15 minutes with a handheld device or a panel. Panel meaning something that you're going to lay on the area. That's going to be more effective than just being under an infrared/red light lamp that's overall, because then it's isolated. The beams of light are localized to that area. And you're going to do it more often because you probably have flare-ups, right? Days that it's worse. Yeah. So you're going to increase the exposure time during those flare-ups. And combine that, of course, with other therapies that you know to do.
Yes.
Okay, so when we talk about infrared, that has ability, and near infrared is invisible to the human eye, so we don't see it. Like the red light, we're going to see red, but the infrared is invisible. That needs to be at an 850 nanometers. So when you're looking to purchase, it's important for you guys to know those measurements. So again, 620 to 700 nanometers for red light, and then at least 850 nanometers for near infrared. Okay, so also when we talk about color therapy, you'll hear people refer to it as chromotherapy. They're just interchangeable terms that are used, but that's what we're talking about, is the use of color and color therapy in the form of, in this particular case, is LED. Okay. All right, so let's take a look at some of the benefits that you can gain from exposure to near infrared and red light. All right, promotes wound healing. So I'm telling you, when I've gotten bit by a spider before, I take my handheld wand, infrared, and it utilizes heat. So it's a combination of heat therapy and red light. And it literally just helps diminish the poison that's in that area. So my itchiness, the redness, the inflammation, all of that just starts to dissipate like within minutes of exposure. That's how effective I find this one device that I have with that. Okay, so promotes wound healing and tissue repair by increasing the blood flow and collagen production. Okay, so that doesn't take rocket scientists to understand that that's the body's, the moment that the body is kind of signaled to go into healing, it's not the infrared that's doing that, it's the body's natural response to wound healing. So it's igniting the body's natural response. It can reduce inflammation and pain, making it useful for conditions like arthritis and tendonitis. Case studies show that red light therapy helps diminish wrinkles, improve skin texture, and builds collagen to improve skin complexion. Now, it's important that you guys also research case studies. That's readily available. You can go to medical journals or just Google search, but you can find this information for yourself, or just come back and visit us here at Empowered Podcast. Other potential benefits include reducing acne and acne scars, lessening psoriasis lesions and burn scars, stimulating hair growth and for alopecia, and improving neural function and cognition. That's why I also like it too, because each color has a different impact on you mentally. Any questions on?
Well, you can. Well, I'm feeling like I missed something, but so chromotherapy, it's like the lead therapy or the red lead therapy. So I got confused a little
Red
bit.
is just one color.
But it's the whole chromotherapy, every
So
color.
chromotherapy is an umbrella of how color is used, because different colors are known to impact our mental state, right?
Yeah, different colors has different levels of vibration, and different levels of vibration reach different levels
Wavelengths. Okay.
Uh-huh.
That's, yes, but also chromotherapy, going back to that term, encompasses color use and the impact that it has on us. You ever heard of the term like painting a certain color in your visit?
Yeah, totally.
So
and then
it's all
lead.
under the same umbrella, but when we come into
The red.
wavelengths of color and LED or chromotherapy, color therapy, that's different. That's measured in wavelengths with the ability to penetrate different levels of tissue.
So the red.
But it's all under the same umbrella.
The red lead. The lead can be also in other colors, but it's being used by red.
Right. So the most common colors used in LED therapy would be blue, yellow, green, red. We also have, violets in different colors, but they're not widely used. But of all the colors that I just mentioned, the 4 colors, red is the only one that has the ability to penetrate all layers of tissue.
I got it now.
Yes.
Okay. So.
And that is highly effective because then it goes, the different.
And then you can combine that with the
near infrared.
The infrared.
Yes.
So the infrared will potentialize that.
Well, it's that it goes to a different depth.
Okay.
And so I'm telling you guys, I'm advising you, if you're going to invest into a device, make sure that it's a combination, that it delivers both through the device. And that's why on our storefront,
I'm clear now.
Yeah. Okay. So also some studies show that it does repair. It may help in cancer treatments. Does repair cancerous cells and lymphedema, something that you like. So there's case studies that support that it improves and helps address these issues. So now we want to discuss some of the benefits of the near infrared, and this is a combination of what I use in my practice and I've seen what it can do for people. So some of the skin benefits of infrared: stimulates cellular energy to promote skin renewal and healing, improving the texture and appearance. Also increases collagen and elastin production, providing anti-aging effects like reducing wrinkles and sagging skin. It also aids in healing skin injuries and wounds faster, with less scarring due to increased collagen production. Some of the anti-inflammatory effects: it counteracts excessive inflammation in the body, which can contribute to various health issues, and it helps heal tissue damage caused by inflammation. Exciting stuff.
Yeah.
Okay, the infrared helps with injury recovery and pain relief by promoting healing to acute injuries, sore muscles, joint and muscle pain, and repetitive injuries. So for instance, one of the patients I work with having an injury from football, so rotary cuff here, never had full motion ever. And so not only did some cupping, but just exposure time to infrared, he can almost do full rotation. He still will have flare-ups, but that's how it helps just repair years of injury, that people just learn to live with that pain, So that's how effective this is.
Well, I'm hearing the benefits of reducing the inflammation, reducing the edema, reducing, breaking up scar tissue, all of that. Very interesting. I have been hearing more and more about it. Clients have been coming from doing that and then doing the lymphatic. And that's why I'm very curious and I'm loving to
it
learn
goes
this.
hand in hand. I mean, seriously guys, that is why in my practice, in Liliani's practice, combining these in every treatment, I don't care if you're coming in to see me as in my weight loss clinic, or if you're coming in to see me for aesthetics, or for counseling, or for just holistic health because you want some natural alternatives to help you, rid this body of this virus that I'm going to incorporate lymphatic drainage and incorporate
the red light.
light therapy. I'm going to incorporate it. Okay, let's jump ahead now and go to some cognitive and neurological benefits from infrared. And so it has the ability to penetrate the skull. So with that, it can increase the blood flow. It increase energy production to the brain cells.
I'm thinking I need you just bathe on them right now.
That's what you do. That's why they have full body chambers that you go in and it exposes the whole body to it. It also improves cognitive function, memory, and symptoms in conditions like traumatic brain injury and dementia. So that is something that you're going to see an increase of usage when it comes to dementia and Alzheimer patients, exposing, especially if you can do it in the early stages. That's why all my daughters have the mask. I made sure Christmas they all got a mask or a device to use this. I see the benefits for rosacea. And there are many things. Rosacea can't be cured, but many things that this can help with. And then NIR, meaning near infrared light, particularly at a wavelength around 850, it can penetrate deep into the tissues and the muscles and the bones, making it effective for a wide range of therapeutic applications when used consistently. And there's that thing that we talked about is consistency. It's a therapy, guys, and it's important to remember that. Just doing it one time or once a week, you're not going to see true benefits. You're going to see benefits like, removing poison or helping, but overall health benefits, you're going to have, consistent exposure time. Okay, so go back to your original question about how many times. This is the recommendation based on case studies. So based on the case studies using red light therapy, effectively exposure time typically ranges from 3 to 7 times a week, with sessions lasting 10 to 30 minutes, okay? For general use and anti-aging, maybe 3 to 5 sessions a week for 10 minutes. And then for pain relief, 3 to 5 times per week for 20 to 30 minutes. So again, that's because it's pain. So
it's depending on what
you're using it for, right? And then, and you can find all of this information on my website under my resource center, under infrared and red light therapy. And then also just remembering that consistency is important, and making sure that the device that you're using or thinking of purchasing is able to penetrate at the right wavelength. And before we close with the infrared, Axel, because it's highly effective in hair loss, and this is more of a newer advancement that we're really seeing before and afters out there. You can Google them for yourself. I'm so impressed. Axel, if you'll play the video of Dr. Amir talking about the benefits of the red light for hair growth, we'd appreciate it.
All right. Yeah, and so with that was very intense, and I love it. I love learning. Oops. So I'm gonna dive into it, because I have seen a lot of clients coming having those, especially at post-surgery, to use them, and I'm curious to how can I incorporate them. So thank you.
Yeah, you're welcome.
So the code for the day.
Well, first of all, we did have a question that came in, and I'm going to answer this question.
Sure, let me get the question.
So the question was, a patient is taking the 𝓘𝓷𝓼𝓽𝓪, and she had heard, she's in I think a support group about
it was from the semaglutide episode that we did.
Yes, and the question was, can she drink coffee? She heard that she knows she's not to drink alcohol, and it's the same reason why she shouldn't drink alcohol as coffee, but the question was, Can I drink coffee while on semaglutide? Is this a true statement?
Well, what I would say is that everything is in balance, and caffeine can dehydrate you. And the problem is not the caffeine, the problem is the dehydration. So I drink my coffee every day, and I'm on the semaglutide for over a year now. And I'm doing well, but it's just one time a day, and I drink my water. I also want to say that a common thing, this is not part of the question, but I want to bring it up, is that the semaglutide is low healing. So if you're going through semaglutide, you want to make sure you take care of your body, so you provide other ways for the body to heal. And I think the red light would be something that would benefit a lot.
Yeah, absolutely. Anytime we're undergoing any type of change to our body, in case of this weight loss, you're going to want to eat as clean as you can and take any extra precaution.
Yeah.
I agree 100%.
Yeah.
So I want to talk about, in this segment, I just want to briefly touch on two of my favorite products. Since we're talking about anti-aging, skincare, and therapies, one of the things that ages us quickly, especially here in California, is the sun. The UVA, exposure to UVA and UVB rays. And it's so important to use sunscreen. I mean, why spend the money and the time investing in anti-aging treatments if you're not using sunscreen?
Simple basic.
And so I'm going to be honest and say I understand why a lot of women, once they do full makeup, don't reapply sunscreen, because what are they going to do? Take their makeup off to reapply it? Well, I found a product that is really effective for that. This is a Set and Protect SPF 45 spray that goes right over makeup. So you keep this in your purse, and what you'll do is, because most SPFs, maybe you should reapply every 2, 4 to 6 hours, depending on how active you are and if you're like out there sunbathing. But what you'll do is midday is you'll take this out and you'll spritz it right over your makeup. So it's like a makeup refresher. It's gonna just kind of refresh everything, but it's gonna seal the sun protection right over your makeup. And no, it's not gonna push your makeup deeper into your pores. And it's not gonna do anything to your foundation or your powder setting. It's actually gonna enhance it and give you a refreshed look. That's exactly what it does for me. But it also just puts that extra barrier right over my skin. So this is a great product. Now this is an SPF 50. It's a botanical mineral-based SPF, but it's a BB cream. Do you know what the BB cream is? It's like not heavy like a foundation. It's like a moisturizer infused with pigment. So this is an SPF 50 made by Australian Gold, and these are also listed on our Empowered Podcast storefront. And I like this because it is so light that you don't have to even put makeup on. It comes in, I think, 3 different shades, and it's very light, gives you the sun protection, gives you a nice glow.
It's just for the face, for the full body?
Well, no, these are all for face. Yeah.
Okay, got it.
And so you can apply this to your face and neck. So it gives you that nice glow, gives you a little bit of color. You can leave just this on. You don't have to put any makeup over this if you don't want. And it comes in an SPF 50. And it just feels so hydrating to the skin.
I'm gonna try because I love those.
So using these two in conjunction with one another is your best defense against the damage from UVA and UVB rays.
Ready?
Yeah, that's it.
That's it?
Yeah.
That was very informative. Okay, so here my quote for the day. Beauty begins the moment you decide to be yourself. And here we are, ending this episode. Thank you for being with us. Your participation will really bring us a smile.
Yeah.
Write it down, that question, make that comment. We like to know what you like about it, especially the uplifting comments. We love it. So, and with that,
well, I have their challenge.
Oh, what is the challenge?
The weekly challenge. So here's your challenge. So I'm going to assume that you're really friendly and you say hello to everybody. But there is impact when you say their name. It makes it personalized, it makes them feel good, it makes them feel relevant and important. So my challenge to you is, when you say hello to somebody, I want you not to just say hello. You're going to say, hello, Liliani.
Like add their name.
Hello, Kelly.
It's gonna be a problem with my memory, but
Hello, Sally. Of course, it's going to be
hi,
authentic.
Christina.
Hello, Christina. Not just hello.
Yeah.
You know, to your coworkers or people that you know.
Can I say darling?
You know, that's
When I don't remember people's
hello,
names.
darling. I think. Okay, this is my personal opinion. I would love for you, if you're watching this episode, to weigh in on this, because sometimes people consider it when they go in, oh, hello, sweetie, hello, darling, like it's just said to everybody.
Mm-hmm.
It's not personalized, because that's the way some people are actually insulted by that, because they're not your darling, they're not your sweetheart, they're not your baby. So how do you guys feel about that? I do, hello, sweetie. Hi, you know, but to people I know very close, but not to
Yeah,
just
that's
rolling
true.
it
For
out
people
there
that I
and
know,
say-
not like on the street.
Yeah,
But that's a very good point.
yeah. So, anyways, thank you guys for joining us. I appreciated being with you, and
I know, this was
can't
intense.
wait to see you next week when we do our episode on. I don't know what we're gonna do.
The next one is our favorite product.
Oh, favorite products. Excited about that.
Yeah. All right.
Guys, talk to you soon.